Okay, so good day. Today we are going to discuss another zoonotic bacterial the bacterial disease known as bovine tuberculosis. Okay, so the overview of today's presentation will cover the information regarding the organism that causes bovine tuberculosis and its epidemiology. We will also talk about the history of the disease, how it is transmitted, species that it affects, including humans, and the clinical and necropsy signs observed. Finally, we will address prevention and control measures as well as testing and actions to take if bovine tuberculosis is suspected. Again, this PowerPoint presentation is made by the Center for Food Security and Public Health of Iowa State University. So now let's go to the organism. Bovine tuberculosis results from infection by Mycobacterium bovis, a gram-positive, acid-fast bacterium in the Mycobacterium tuberculosis complex of the family Mycobacteriaceae. So we know that the Mycobacterium or the mycobacteria are characterized by a very thick cell wall or cell membrane composed with mycolic acid. That's why it is very hard to destroy. Sometimes antibiotic therapy of tuberculosis in the minimum would last for 3 months. And the antibiotics that are used usually for this are ethambutol, isoniazid, and rifampicin. Rifampicin, the antibiotic that targets the RNA synthesis. Okay, so Mycobacterium tuberculosis, Mycobacterium africanum, and Mycobacterium caneti found in humans, and the animal adapted species Mycobacterium bovis for bovine, Mycobacterium caprei for goats, and Mycobacterium pinnipedi for seals, and Mycobacterium microti for rodents, and the like. So Mycobacterium bovis can survive for several months in the environment, particularly in cold, dark, and moist conditions. So now let's go to the history of tuberculosis. So in 1898, the bovine and human forms of Mycobacterium bovis and Mycobacterium tuberculosis were differentiated. In the early 20th century, tuberculosis or TB was the leading cause of death in the United States, taking roughly 148,000 human lives in 1900s. It is estimated that 10% or more of TB cases were actually due to the bovine form, contracted by contact with cattle and cattle products or even swine. And the State Federal Cooperative Bovine Tuberculosis Program was initiated in 1917. This is discussed later in our presentation. So in the Philippines, we also have TB dots. So we have several programs of the Department of Health of the Philippines that aims to test and treat tuberculosis in the Philippines. So in the Philippines, around 60 to 70% of the population is reactive with tuberculin test. So that's the test to determine if they have or we have an exposure to tuberculosis. So tuberculosis is very much endemic in the Philippines, but there are no studies yet to identify whether the predominant species or the predominant tuberculosis in the Philippines is caused by the zoonotic strain, Mycobacterium bovis, but more likely it is the Mycobacterium tuberculosis that is found in humans. Okay, so now let's go to the epidemiology or the spread or the distribution of the disease. Although bovine tuberculosis was once found worldwide, control programs have eliminated or nearly eliminated this disease from domesticated animals in many countries. Nations currently classified as tuberculosis-free include Australia, Iceland, Denmark, Sweden, Norway, Finland, Austria, Switzerland, Luxembourg, Latvia, Slovakia, Lithuania, Estonia, the Czech Republic, Canada, Singapore, Jamaica, Barbados, and Israel. Eradication programs are in progress in other European countries, including other countries in East Asia, such as Japan. So Japan still has tuberculosis in the cattle herds: New Zealand, the United States, Mexico, and some countries of Central and South America. Although bovine tuberculosis has been eradicated from the majority of the United States, a few infected herds continue to be reported, and a few states may periodically lose their disease-free status. In particular, a focus of infection in wild white-tailed deer has complicated eradication efforts in Michigan. Similar problems exist with infected badgers in the UK and Ireland, and infected brush-tailed opossums in New Zealand. Bovine tuberculosis is still widespread in Africa as well, and parts of Asia and some Middle Eastern countries. And this map shows, from the World Health Organization, shows the distribution of bovine tuberculosis from January to June of 2011. So the red indicates a current disease event, purple indicates disease is limited to one or more zones, and dark green indicates that the disease is not reported in this period, and light green indicates disease never reported. So in the Philippines, you can see it is light green, so it is never reported. So it's a good way, or a good study for us to determine if our cattle herd or even our carabaos harbor Mycobacterium bovis, or a different species of Mycobacterium causing tuberculosis, zoonotic tuberculosis. So the transmission, so Mycobacterium bovis can infect humans primarily by the ingestion of unpasteurized dairy products, but also in aerosols and through breaks in the skin. So raw or undercooked meat can also be source of the organism, and person-to-person transmission is rare in immunocompetent individuals, but Mycobacterium bovis has occasionally been transmitted within a small cluster of people, particularly alcoholics or HIV-infected individuals. Rarely, humans have infected cattle with aerosols or in urine. So most animal species are considered to be spillover hosts of Mycobacterium bovis. Populations of spillover hosts do not maintain Mycobacterium bovis indefinitely in the absence of a maintenance host, but may transmit the infection between their members or other species for a time. Some spillover hosts can become maintenance hosts if their population density is high. So bovine tuberculosis is usually maintained in cattle populations, but a few other species can become reservoir hosts as well. Cattle shed Mycobacterium bovis in respiratory secretions, as well as in the feces and the milk as well, and sometimes in the urine. Vaginal secretions or semen are also fluids where you can get where the Mycobacterium bovis is also shed. And large numbers of organisms may be shed in the late stages of infection. Asymptomatic and anergic carriers occur. In most cases as well, Mycobacterium bovis is transmitted between cattle in aerosols during close contact. So usually in the paddock or in the animal house. So some animals become infected when they ingest the organisms as well. This route may be particularly important in calves that nurse from infected cows. Cutaneous, genital, and congenital infections have been seen but are quite rare, and all infected cattle may not transmit the disease. So Mycobacterium bovis can be transmitted by the inhalation of aerosols or aerosolized secretions, by ingestion or through breaks in the skin. The importance of these routes varies between species, and ingestion appears to be the primary route of transmission in pigs, ferrets, cats, and probably the deer as well. In addition, cats can be infected by the respiratory route or by percutaneous transmission in bites and scratches. Non-human primates are usually infected by inhalation, and the aerosol transmission also seems to be the main route of spread in badgers. But transmission in bite wounds can be significant. Badgers with advanced disease can shed Mycobacterium bovis in the urine, and organisms have been found in the feces as well. Due to the behavioral changes, badgers and possums are most likely to transmit Mycobacterium bovis to cattle during the late stages of the disease as well. So now let's go to the disease in humans. Human tuberculosis due to Mycobacterium bovis has become very rare in countries with pasteurized milk and bovine tuberculosis eradication programs. However, this disease continues to be reported from areas where bovine disease is poorly controlled. The incidence is higher in farms or in farmers, abattoir workers, and other people who work with cattle. Some human infections are asymptomatic. In other cases, localized or disseminated disease can develop either soon after infection or many years later when waning immunity allows the infection to reactivate. Localized disease can affect the lymph nodes, skin, bones, and joints, and the genitourinary system, as well as the meninges or respiratory system. Cervical lymphadenopathy, so the one in the neck, no? The lymph nodes there, also known as a scrofula, which primarily affects the tonsillar and preauricular lymph nodes, was once a very common form of tuberculosis in children who drank infected milk. In some cases, these lymph nodes rupture and drain to the skin, causing chronic skin disease. No? Lupus vulgaris may occasionally result. But please take note that this lupus vulgaris is different from the SLE, no? Systemic lupus erythematosus caused by an autoimmune disease. Humans infected through the skin can develop localized skin disease known as a butcher's wart, a form usually thought to be benign and self-limiting. Pulmonary disease of bovine tuberculosis is more common in people with reactivated infections than initially. The symptoms may include fever, cough, chest pain, cavitation, and hemoptysis, no, or blood in cough. No? So usually also the fever is characterized by night sweats. No? Genitourinary disease can result in kidney failure. Bovine tuberculosis can be treated successfully with antimicrobial drugs or antibiotics, but untreated infections may be fatal in humans. No? So now let's go to disease in animals. So, of course, Mycobacterium bovis, cattle are the primary hosts, no? But other domesticated and wild mammals can also be infected. Known maintenance hosts include the brush-tailed opossums, no? And possibly ferrets as well in New Zealand, badgers in the United Kingdom and Ireland, bison and elk in Canada, and kudu and African buffalo in southern Africa. So in the Philippines, we haven't had any extensive research on Mycobacterium bovis, but I think it is really the time to research on this and to determine whether our carabao, no, can be afflicted or infected by this disease, no? Or can be carriers as well. White-tailed deer in the United States, especially in Michigan, have been classified as maintenance hosts. However, some authors now believe that this species may be spillover hosts that maintain the organism only when its population density is high. No? So species reported to be spillover hosts include the sheep, goats, horses, pigs, dogs, cats, ferrets, camels, llamas, and many species of wild ruminants, including deer and elk. Elephants, rhinoceros, foxes, coyotes, minks, primates, no? Opossums, otters, seals, no? Sea lions, hares, raccoons, bears, warthogs, and large cats, including lions, tigers, leopards, cheetahs, and lynx, and several species of rodents may also serve as hosts. No? So most mammals may be susceptible. So there's a lot of animals that may be carry the disease, no? The Mycobacterium bovis. No? So the symptoms of bovine tuberculosis usually take months to develop. So Mycobacterium, as you may know in your a review of your microbiology, it takes a very long time to grow even in culture media, no? Usually around a week or two. So similarly in the host, in the cattle, it would take months, no, to develop, no? And infections can also remain dormant, so it may sleep, no? It may sleep for a while, for years, and reactivate during periods of stress or in old age. No? Early infections are often asymptomatic. No? In the late stages, common symptoms include progressive emaciation, a low-grade fluctuating fever, weakness, no, inappetence. Animals with pulmonary involvement usually have moist cough, no, that is worse in the morning during cold weather or exercise, and may have dyspnea or tachypnea. In the terminal stages, animals may become extremely emaciated and develop acute respiratory distress, and in some animals, the retropharyngeal or other lymph nodes enlarge and may rupture and drain as well. So again, in your review of your pathology, this is the a very characteristic, how do you say this, lesion that is found in Mycobacterium, where the lymph nodes become caseous, and when you cut it, it becomes gritty or sandy. No? So that's what happens. No? That's what you call caseous lymphadenitis. No? And since the lymph nodes are greatly enlarged, it may obstruct blood vessels eventually, and of course the airways as well. So it is usually found in the cervical region or the neck. There is dyspnea definitely. If it's on the digestive tract, intermittent diarrhea and constipation may be seen. In cervids, bovine tuberculosis may be a subacute or chronic disease, and the rate of progression is variable. In some animals, the only symptom may be abscess of unknown origin in isolated lymph nodes, and symptoms may not develop for several years. In other cases, the disease may be disseminated with a rapid fulminating course. So how do we identify or how do we test for tuberculosis, especially in animals or in cattle? The TB skin test is the common name for the single intradermal comparative cervical tuberculin, or SICCT test. This skin test is regarded as the definitive indicator of infection by the bacterium that causes TB in cattle, Mycobacterium bovis. This test is required in the EU and has proved to be a reliable tool worldwide. In Northern Ireland, all herds are tested annually as a minimum requirement, but some are tested more frequently if they are considered at an increased risk. On day one, so day one of the test, 2 sites are clipped. So for example, so 2 sites are clipped. For example, this is the clipped area. The skin thickness at both sites are measured and recorded. So using a caliper, you can measure the thickness of the skin by folding the skin and dividing it into 2. The skin thickness at both sites are measured and recorded. 2 types of tuberculin, one from killed Mycobacterium bovis, so that's the bovis strain, and another killed Mycobacterium avium, so that's the bird strain. These are then injected under the skin, so here. So the injection is what we call intradermal injection, not subcutaneous, intradermal, just under the skin. And usually the difference between intradermal and subcutaneous is that for intradermal, the bevel of the needle is facing upwards. Normally, for subcutaneous injection, the bevel or the hole of the needle is facing downwards. So that's the difference of the different injection types. Oh, sorry. Rather, I got it inverse. So for the intradermal, I'm sorry again, the bevel is pointing downwards, intradermal for tuberculin test. For subcutaneous, the bevel is pointing upwards. So again, the bevel points upwards in subcutaneous injection. And for intradermal, the bevel faces downwards. I'm so sorry, I got confused. So that's the difference. So the bovine site and the avian site. So there are 2 areas that you will clip, and you inject 2 different proteins. Purified PPD, purified protein derivative, or killed bacteria. And on the day 4 of the test, the skin reactions to the 2 types of the tuberculin are measured and compared. When the bovine site reaction exceeds avian site reaction by more than 4 millimeters. So 4 millimeter is the keyword here. Pag mas malaki ng 4 millimeter yung sa bovine injection site, then it is positive, no? Or a reactor siya, no? And when the bovine site reaction measures 1 to 4 millimeter more than the avian, no, the animal is declared as inconclusive under standard interpretation. So if it's less than 4, almost equal the size of the avian strain, then inconclusive siya. So you have to do further tests, no? Probably PCR, more sensitive tests. No? So you can see here on the leftmost photo, the negative animal or the negative cattle is non-reactive. So there are no bumps developed under the skin. No? And here, this is inconclusive because the size is the same. No? So less than 4, no? Less than 4 millimeter, and also almost the same size, no? For the avian and the bovis strain. But here you can see the bovis is so big, while the avian here is even non-existent, no? So it's a positive reactor, no? So it's a positive reactor for the test. Okay. So this is in other animals. In cats, the symptoms may include weight loss, no? A persistent or fluctuating low-grade fever, dehydration, decreased appetite, and possibly episodes of vomiting or diarrhea. So it's quite non-specific. And the cat may have coughing, dyspnea, and rales as well. And in the abdominal form, enlarged mesenteric lymph nodes may be observed or palpable. And skin infections are also common in cats. That's why it may appear as a soft swelling or flat ulcer. No. Okay, so the post-mortem lesions, or the lesions that you will see here, is that bovine tuberculosis is characterized by the formation of granuloma, so tubercles. That's why even in humans, when they perform, or when you perform the radiograph or X-ray, you will be able to see that the lungs have circular lesions, very white, no? Because it forms granuloma, no? So why? Because the bacteria is being localized, being attacked by the body, so it is surrounded by granulomatous tissue, no? Similar with Paragonimus, diba? Paragonimus infection or the lung fluke. These granulomas are usually yellowish and either caseous or caseo-calcareous or calcified. So number 1, caseous. Caseous, it looks like cheese, no? So kaya nga queso, no? Caseous. Caseous appears yellowish and hard. Caseo-calcareous or calcified, it means that it already hardened, no, to calcium, no? So caseo-calcareous or calcified, they're often encapsulated, no? Some form, or in some species such as the deer, the lesions tend to resemble abscesses rather than typical tubercles. And in cattle, tubercles are found in the lymph nodes, particularly those of the head and the thorax. And they are also common in the lungs, the spleen, the liver, and surfaces of the body cavities. No? Lesions are sometimes found in the female genitalia as well, but are rare, no, on the male genitalia. In cervids or in deer, tubercles are most common in the lymph nodes, no, of the head and the thorax, particularly the medial retropharyngeal lymph nodes. For Mycobacterium bovis, tubercles are not usually calcified, no, in cats or in dogs. No. In cats, they can be found in the lymph nodes, lungs, and other organs. Pleuritis, peritonitis, and pericarditis may also be seen. And in dogs, tubercles are common in the lymph nodes, no? The lungs, in the liver, in the kidney, and including the pleura and peritoneum as well. No? A straw-colored fluid may be found in the thorax, and although some infected badgers have disseminated disease, many others may have minimal localized lesions as well. In contrast, brush-tailed opossums tend to have extensive lung cessation and caseation and necrosis. So, para sa mga brush-tailed opossum, yung mga usual na mga reservoir hosts or hosts sa North America, caseation or pagiging keso nung baga at saka necrosis or pagkabulok, no? So those are the common lesions, no? So in this photo, the top, no, this one is a picture of an elk lung and the lymph node. So this is the lung, and the lymph node is on the right. The lung contains multiple coalescing foci of caseous necrosis, no? Makeso, no? This one, ayan, no? Madilaw, yellowish, okay? And this is surrounded by thin, pale, fibrous tissue, the white one. These are fibrous tissue. This is not exudate, or these are not fat, no? And as well as the capsules, no? So below is a bovine lung, no? And the lung parenchyma that is almost entirely replaced by variable size coalescing raised pale nodules. So you can see here on the bottom part, no? Sobrang severely affected sila with the bacteria. Okay, so for the morbidity and mortality in countries where or with control programs, bovine tuberculosis is often confined to 1 or 2 animals in a herd. Most reactors are detected during routine testing, and mortality from tuberculosis is quite rare. In 2 studies of transmission from naturally infected reactor cattle, 0 to 40% of susceptible contacts became infected, and 0 to 10% developed gross lesions. In maintenance hosts other than cattle, the prevalence and infection and the severity of the disease vary with species. In Ireland, more than 40% of culled badgers have found to carry Mycobacterium bovis in some studies. Most of these animals remain unaffected. 50 to 80% of infected badgers have no visible lesions, and 5% or less develop generalized disease. In contrast, bovine disease is usually progressive and fatal in brush-tailed opossums, especially in New Zealand. Although more than 50% of the opossums can be infected in localized areas, the prevalence of infection in this species is typically 1 to 10%. In the Michigan white-tailed deer population, the annual prevalence varies from 2% to 4%, so it's not that high. In affected regions of Canada, the prevalence of Mycobacterium bovis in wild elk appears to be approximately 1%, but mature males have a prevalence of nearly 5% when bovine tuberculosis is uncontrolled in cattle. No? A high incidence of disease may be seen in cats as well. No? Up to 50% of cats may be infected on an affected farm. No? So that's why stray cats, no, please control, especially if it's in the farm. No? So differential diagnosis, so it's quite difficult, no, especially for an unexperienced clinician. So that's why if you see respiratory problems or respiratory lesions, always include the rule outs for tuberculosis. Tuberculosis can be difficult to diagnose based only on clinical signs because it is found internally. No? In developed countries, few infections become symptomatic. Most are diagnosed by routine testing or found at the slaughterhouse. In cervids or in deers, tuberculosis should be considered in the differential diagnosis when abscesses of unknown etiology are found. The differential diagnosis includes contagious bovine pleuropneumonia or CPP, Pasteurella or Corynebacterium pyogenes pneumonia, aspiration pneumonia, which is often secondary to chronic wasting disease in deers, and traumatic pericarditis as well. So this is hardware disease, no? Traumatic pericarditis, because for example, a deer accidentally ingests a metal or a nail, and then from the rumen, sometimes it punctures the heart, no, from the rumen, no, because of the movement, no, contraction. And caseous lymphadenitis as well, or melioidosis in small ruminants, and chronic aberrant liver fluke infestation should also be one of the differential diagnoses, because most of these lesions almost share similarities in presenting signs. So another, no, as I mentioned earlier, meron tayo nung subcutaneous, no, injection, intradermal injection. There is another test, no, for cattle. This is what we call tuberculin skin test, no. In live cattle, tuberculosis is usually diagnosed in the field with a tuberculin skin test. So the other one that I showed earlier is on the neck. This one is on the caudal fold. This one is the more commonly used, no? Tuberculin test. In this test, tuberculin is injected intradermally. A positive test is indicated by a delayed hypersensitivity reaction or swelling, similar to the one that I posted or discussed earlier. The tuberculin test can be performed using bovine tuberculin alone or as a comparative test that distinguishes reaction from Mycobacterium bovis from reactions to environmental mycobacteria. Now, so the US uses the caudal fold because it's easier to observe or to see. So this test for preliminary screening of cattle, reactors are retested with the comparative cervical test. So, dito yon sa neck. No? So, pag nag-positive sa buntot, then tsaka nagpo-perform ng neck. No? So, sa EU, ang sa kanila, neck na agad. No? So, the single cervical test is used for preliminary screening of cervix, and a comparative cervical test is used for initial screening of cattle in Europe, no? As I've mentioned earlier. False negative responses are sometimes seen soon after infection in the late stages of the disease in animals with poor immune responses and in those that have recently calved. No? So there are cases where the tuberculin test might come out false negative. No? Pwedeng akala nila hindi affected ng Mycobacterium bovis yung cattle pero infected pala. So may mga stages or may mga certain issues, no? Like poor immune system, bagong panganak, no? So bagong infected, no? Pwede yun mag-negative, no? So please take a note that you have to repeat the test. No? You have to repeat the test. Okay, so aside from that, there are other diagnostic tests that you can use. You can presumptive diagnosis can be made by histopathology, no, microscopic demonstration of acid-fast bacilli. So again, this is the staining procedure for tuberculosis, diba? Acid-fast. And direct smears from clinical samples or tissues may be stained also by Ziehl-Nielsen. Fluorescent acid-fast stain or immunoperoxidase techniques. No? Diagnosis is confirmed by the isolation of Mycobacterium bovis on selected culture media. No? So usually incubation period grows very slowly. No? Cultures incubated for 8 weeks, no? So more than or 2 months. No? Growth usually becomes visible 3 to 6 weeks. No? The identity of the organism can be confirmed by biochemical tests and culture characteristics, or the very easier one, polymerase chain reaction or PCR. No? So other assays are typically used as ancillary or auxiliary tests, no? Including the tuberculin test. Lymphocyte proliferation and gamma interferon assays are blood tests that measure cellular immunity. The gamma interferon assay is particularly useful in animals that are difficult to capture or handle, as they must be captured only once rather than twice for the tuberculin test. Kasi nga, diba, sa tuberculin, kailangan ulitin. The lymphocyte proliferation test is uncommonly used in cattle but may be useful in wildlife and zoo animals as well. So now let's go to the prevention and control. So bovine tuberculosis is a reportable disease. Now, state authorities should be consulted for specific regulations. So in the Philippines, I'm not quite sure if it's also a reportable disease, but there are lacking reports in our country about bovine tuberculosis. So again, this is a very good room for research. No? So this is for the US, but of course for the Philippines, you may report the cases to the Bureau of Animal Industry, BAI, no, of the Department of Agriculture. Okay, so let's skip this one because this is for the US. So prevention and control, test and slaughter would be the ideal method. No? Okay, so wildlife reservoir host. No? Vaccines are not currently available, no? So treatment is also not advised because it will cost too much. So for example, you are going to treat a cattle with antibiotics using rifampicin, it is very, very, very expensive, no? Because the cattle weighs maybe 200 kilograms. So how many capsules of rifampicin will you use? And also, it won't be fit for human consumption for a time because of antibiotic residue. So additional sources, of course, you may look at the Center for Food Safety, Security, and Public Health of the Iowa State University, and you can also check bovine tuberculosis in the USDA website and also in the BAI, and also other pertinent government websites that would discuss about bovine tuberculosis. So again, this presentation is developed by the Iowa State University College of Veterinary Medicine, and I thank the authors, Dr. Carrie Leadon Larson, and reviewers, and also Dr. Anna Rovitz-Spickler, and the reviewers, Dr. Glenda Dvorak. Thank you very much for today. Thank you very much for listening for today's lecture, and have a great day, everyone.